You didn't go to medical school, you didn't do a residency, all the things that, I and many other physicians did, but that doesn't negate the experiences that you've had as a
Mhm.
patient and as a family member.
Now a message from Sun Pharmaceuticals. For patients with locally advanced basal cell carcinoma who are not candidates for further surgery or radiation, Hedgehog pathway inhibitors offer a targeted systemic approach. Staying current on these therapies can help you expand options for appropriate patients. Welcome to That's Derm Good. Today, my guest is Dr. Nicole Rochester. She is a healthcare advocate, physician, speaker, entrepreneur, and the CEO of Your GPS Doc LLC. Welcome, Dr. Nicole. Thank you for joining me.
Thank you so much. Thank you for having me.
Yes, I'm so excited to hear a little bit about your company, your GPS doc. It sounds really cool. I like the name of that. But we were, I guess, at the Healthcare Advocate Summit a couple years ago. I think you met my producer, Kyla. But tell me a little bit about why you wanted to go to the Healthcare Advocate Summit. I've been going there since they started, and I absolutely love just going to meet so many people that are passionate about advocacy and helping to support patients. But one of the really cool things is it's across all specialties. So, I'm in dermatology, but with the Healthcare Advocate Summit, there's all specialties and everybody is advocating for their patients.
Absolutely. That was my second year. So I attended my first Healthcare Advocate Summit in 2023. And the main reason I go is that I am a professional healthcare advocate. I'm a pediatrician by training, but I transitioned to professional or independent healthcare advocacy in 2017 when I started my company, Your GPS Doc. And so there weren't really many opportunities when I first started my business to learn more about advocacy in a professional setting, and certainly not to network with such a large group of advocates, as you stated, both independent advocates like myself, but also, individuals who do advocacy in different settings across specialties, clinical, non-clinical. So I was really excited about the opportunity to be in a space with so many other like-minded individuals, and being able to learn about the industry and learn about what people are doing outside of independent healthcare advocacy. And then when I went back in 2024 for the second time, I was able to be a speaker. So I'm sad that I missed it this year, but I'm looking forward to going back next year.
Yeah. So, what were you speaking about?
Yeah, in 2024, I spoke about really health equity and kind of the role of patient advocates as it relates to health equity. And it was a modification of a talk that I've been giving for several years that really provides some foundational knowledge and education about health disparities, health inequities, how we got here, and talks about structural racism and implicit and explicit bias. And at the conference or at the summit, it was really meant to help healthcare advocates understand their role and things that we should be aware of, and ways that we can support marginalized members of marginalized communities.
Yeah. So, what was the turning point in your journey that led you from pediatrics to becoming a professional healthcare advocate and an entrepreneur?
Yeah. I would have never, ever, ever, ever dreamed of myself doing any of this, especially being an entrepreneur. I didn't even want to start my own medical practice. And for years, my family members kept asking year after year, Nicole, when are you going to start your practice? And I was like, never. Had no plans or thoughts about entrepreneurship. And frankly, just had some fears and misconceptions about business ownership. And so I was a
Mhm.
very happily employed physician, loved my job. But my late father, who had a lot of chronic health conditions, had a decline in his overall health in 2010. And it required my two older sisters and I to fairly abruptly start caring for him. And while I didn't identify myself as a caregiver at the time, I don't think my sisters did either. We were just doing what we needed to do to make sure that our dad got what he needed. And so as the doctor in the family, I became the person who was primarily overseeing his health care, his medical care. So
Mhm.
what that meant is I went from being the nagging daughter that I had always been, the nagging physician daughter that would ask him about, what he was eating and was he taking his medications, to then being more formally involved by going with him to his medical appointments. Unfortunately, he had a lot of emergency department visits, so going to the ER, then he'd be hospitalized. So being at his bedside in the hospital, and then often those hospital stays would lead to a short stint in a rehab facility. And then ultimately we moved him into an assisted living facility. So I got to see like the whole gamut of
Mhm.
healthcare. And frankly, I was shocked at how uncoordinated, discoordinated the whole system was. I
Mhm.
was really disheartened by the poor communication. I was frustrated by the fact that I felt that he was often ignored, that I was ignored as his daughter, as his caregiver. And initially, I did not announce what I did for a living because I didn't think that I needed to do that. But it became clear that I needed to do that
Mhm.
because I just got frustrated one day and I just mentioned, I'm a physician too. And they were like, "Oh, you're a doctor?" And so basically, what I saw during that 3-year caregiving journey is that my ability to advocate for my dad, one, was absolutely necessary. There were so
Mhm.
many times where we were going down a path where he would not have received appropriate care. And it was only because of me speaking up or asking questions that things shifted. And I realized that my ability to advocate for him also was highly influenced by my medical degree and the knowledge that I had, the expertise, even the influence, which I didn't like, but they treated me differently. They treated him differently.
Mhm.
And what I started to understand is that, okay, as hard as it is, it's gotten a little bit easier for us, but how much more difficult must this be for people who don't have a daughter or a son
Right.
or whatever, who happens to be a doctor? And I honestly started getting really upset because I just kept imagining how a certain scenario would have gone if I was a layperson. And so that just led me to really starting to think about how can I do this for other people who aren't my dad, especially after he
Mhm.
passed away. I just started feeling really strongly that there was something else I was supposed to be doing. But it took me a while to really transition out of my medical career because I actually loved my job at the time and I loved what I was doing. But eventually I just couldn't ignore, this. It was like honestly like a spiritual calling
Yeah.
that I was feeling. And so yeah, that's what led to me transitioning into health advocacy
Wow.
and really just wanting to show up for other people the way that I was able to show up for my dad and not only
Mhm.
advocate for them, but give them the tools so that ultimately they can advocate for themselves.
Right. It's really interesting. So, as a physician, your years of treating patients, you never really saw that side of, the support, all the hoops that you have to jump through and all of the frustrations. Now, being on both sides of it, do you ever feel like, okay, now I remember when, maybe it was a patient that was frustrated about a process or something, and now you actually get it?
Yeah, for sure. And I will say, I am sure as a physician, I'm sure I had missteps and I'm sure that I had, frustrated families. But what I will say is, as a pediatrician, part of the shock that I experienced when I was caring for my dad is that my world of pediatrics, for the most part, looks very different than adult medicine in that,
Mhm.
children are naturally viewed as vulnerable and
Mhm.
also they have parents or guardians, and so it's normalized and part of our practice to get information from the patient, the
Right.
pediatric patient, even if it's an adolescent, but then to also want to talk to mom or dad or
Right.
grandma or babysitter or teacher. And so one of the things I really prided myself on is I was a talker. It didn't bode well when I did primary care, but I like to talk with my patients and families. I like
Mhm.
to engage with them, and so that was kind of how I was used to practicing. So then going to the doctor with my dad, and I get it. As a physician, I could understand that they were behind. You could see that they were
Mhm.
busy and all the things. So I got it. But also, like, seeing how they really didn't want me to speak up, because in many cases, I was the thing keeping them from getting to their next patient. And I
Right.
understand that. So, yeah, it was really interesting to be on the other side of it. And there were times where I thought back, like, oh, wow, like, I wonder if how was I on the other side of this? And did I
Mhm.
not always do a good job facilitating these types of conversations?
Yeah. But once you told them that you're a physician, how much did that change?
Oh, it was like night and day in many
That is
cases,
so wild.
and yeah, that's what it really It really made me angry. I mean, because I've never ascribed to the whole VIP thing. I remember
Mhm.
in medical school, I don't know if they still have it, but we actually there was like a literal VIP wing. Like this little remote area. I think it maybe had 2 or 3 private rooms. You wouldn't
Mm.
even really know it was there. I didn't know it was there as a medical student until we had a VIP patient that I was responsible for caring for. And I remember even way back then just thinking like there's something wrong with this idea that, you know, if you know someone who knows someone, or if you're a family member of a
Mhm.
hospital exec, that you get to get this special treatment, you know, decreased nurse to patient ratio and just access to all
Mhm.
kinds of things. So anyway, I've just always been a little bit of a disruptor, I guess, and a naysayer. And so I believe in my heart that every patient deserves to have the best quality care. And while I understand just from a psychological standpoint that once you find out somebody is a doctor or a nurse, or sometimes they may say they're a lawyer, it's like, oh my gosh, they're a lawyer. I get it that that might,
Yeah.
you know, make people treat you differently. But for me, it's like whatever kind of treatment my dad got once they found out I was a doctor is the same treatment he should have gotten when they thought I was a nobody.
Right. Now, a message from Sun Pharmaceuticals. For patients with locally advanced basal cell carcinoma who are not candidates for further surgery or radiation, hedgehog pathway inhibitors offer a targeted systemic approach. Staying current on these therapies can help you expand options for appropriate patients. It's so sad to hear that that is actually even happening, but that's really how people think. I mean, just thinking of, when you're walking down the street judging people just based off of their looks, that's just how we're built,
Yep.
unfortunately, with those bias. But you would think that we would hold our healthcare professionals to a higher standard.
Yeah, for sure. You would think.
So you learned a lot about like insurance as well. Were you
Oh
dealing
my
with
gosh. Yes, and again, you know, as a pediatrician, I didn't know anything about Medicare because I really didn't need to
Mm,
know anything. Like kids aren't on generally, kids are not on
right.
Medicare, and so I got like a crash course in Medicare. And then my dad was a retired police officer for DC, so he had private insurance as a retiree. And so navigating those two insurances and which one was primary and which one was secondary, and yeah, I learned
Mhm.
a lot as his caregiver, and you know, I'm thankful because all of that ended up being to my benefit and to, you know, my client's benefit as an advocate. Because even though I'm a pediatrician, all of my health advocacy work and all of my clients are adults. I don't do pediatric advocacy because I saw the need uniquely in the adult and like aging adults and their family caregivers, and so most of my work in advocacy has been in that space. So I've
Mhm.
been able to use all the things I learned when I was caring for my dad, and then I did a lot of education on my own, you know, to make sure that I learned even more so that I could better understand the landscape.
Yeah. So, how did your clinical background, well, we know how your clinical background really influenced how you navigated your father's care, but how did that experience shape your GPS doc?
So I would say my clinical background, it's interesting. So I'm a pediatrician. I mentioned that I don't do pediatric advocacy, but the reality is even when you've been specializing in a particular field for a long amount of time, there's still that knowledge that that I had from medical school. And so the core medical knowledge, surprisingly, a lot of it would come back to my remembrance. I think the main way though is this just understanding not just the medical diagnoses themselves, because frankly,
Mhm.
as an advocate who also happens to be a physician, you're walking a fine line, but we are not their doctor. Like I am not my client's doctor. And it's easier to stay away from that line because I'm a pediatrician and I'm mostly working with adults. But it's having that understanding of the healthcare system and how the healthcare system works,
Mhm.
and also having the clinical knowledge. And for me, largely it's been having the ability to vet the clinical knowledge and to be able to look at research studies and understand them. Also, my network. And so, being a physician in the advocacy space has been extremely helpful because I can reach out to colleagues who are in the specialty for which, you know, my client needs, and be able to say, like, hey, I'm looking for an oncologist who specializes in this, or I'm looking for a surgeon who specializes in this. And I can rely on individuals in my network, or,
Mhm.
connections to individuals in my network. That has been incredibly helpful. There have been times where my client needed a second opinion, or maybe even needed transfer to another facility that could better provide care. And because I'm a physician and I know this is true, I've been able to call institutions and just say, like, hi, my name is Dr. Nicole Rochester. I'm a professional health advocate. My client needs XYZ. I'd love to be able to speak to Dr. So and so. And this has happened where Dr. So and so is like the world renowned expert in that condition.
Mhm.
And they have called me back, whereas I have other advocate colleagues who are amazing, but they're not physicians. And again, this goes back to
Mhm.
this dichotomy where they leave messages and sometimes they say nobody calls them back, or they're left on hold. But, I've been able to leverage my physician title for good. And just like I was leveraging it when I was advocating for my dad, I've been able to leverage that to be able to connect with individuals, specialists, and healthcare providers. So,
Yeah,
yeah,
it's so needed.
yeah, and I'm using my medical degree in a different way, but I love how I've been able to leverage that experience in this
Yeah.
area, in this new expertise.
Yeah. So tell me a little bit about your GPS doc, what all you do, and how you connect with patients, and how the whole process works.
Yeah. So the company, everything has evolved since I first started. So now there's a lot of different things that I do. But in the advocacy space, I love working with family caregivers, particularly because I was in that role, particularly an adult child who is struggling. They're in that sandwich generation where they have aging parents who are starting to
Mm.
have more healthcare needs, but then often they have their own family, their own children, their own spouse or partner, and often they're at a point in their career where they're, kind of rising up the corporate ladder, so to speak. And it becomes very difficult to navigate both worlds. And so a lot of times they will reach out because they just don't have the capacity. They love their parents, they want to be able to be present. Sometimes maybe they're physically located hundreds of miles away, and sometimes not, but sometimes they just don't have the capacity. And so they will hire me as their parents advocate, and
Mhm.
in some ways, it's helping them stay in the loop with their parents' permission, making sure that they're kept in the loop, updated after doctor's appointments, but it's also supporting their parent to prepare for appointments, to anticipate next steps. So I'm like an interpreter. I can look at the medical knowledge and I can literally take it and then put it in lay terms with
Mhm.
my clients. Sometimes it's helping them understand their health insurance benefits. Sometimes they may need to helping them adjust their health insurance in open enrollment season, helping them vet and research medical providers as well as facilities. So maybe they have a surgery and they're going to need a rehab facility, helping them vet because which ones are good, which ones have high quality ratings versus not. Home
Mhm.
care agencies, but then also sometimes it's the patient themselves who's reaching out. And so, I've worked with clients who had a new diagnosis and upcoming appointments, and they were overwhelmed with the example with cancer, needing to see an oncologist and a surgeon, and just wanting someone to help them understand what all of this means, helping
Mhm.
them interpret their lab reports or their radiology reports. And I do a lot of education. Like I really like educating, and ultimately my goal is to put them in a position where at some point they don't need me. I'm happy to help if you need me in the future, but I love to be able to educate them and empower them
Mm.
with tools so that moving forward they feel more confident and
Yeah.
more comfortable engaging with members of their medical team, asking questions,
Right.
speaking up respectfully, all of those things. So that's
Mhm.
the advocacy part. And then I also do a lot of public speaking and training. So I do speaking around health equity and health disparities. I do speaking around patient and family engagement and the importance of truly involving the patient and families in their care, and
Mhm.
also around empathy, restoring empathy in healthcare, which I think is a huge problem right now with the way
Yeah.
that the system is forcing doctors and other healthcare providers to practice. So
Mhm.
I have a workshop where we in live time, in real time, get to practice empathy skills and really just underscoring the importance of humanity
Mm,
and how that breeds trust or lack thereof, and the challenges that we have now with regard
yeah.
to mistrust. So that's the speaking. And then I also do consulting, healthcare consulting with hospitals and other healthcare organizations. And then I also coach physicians who want to start their own version of your GPS doc. So all of
Wow.
those things keep me busy, but it's lots
Yes.
of fun.
Yeah, that's so exciting. I feel like there's so much to unpack there. The need for someone that can help educate and inform. When you are newly diagnosed with something that you just don't quite understand and you've got to go to multiple different doctors, I mean, it's overwhelming. And most of these
Mhm.
appointments, these visits, you don't have much time. So when you're trying to download all this information, you're still thinking in your head, like, I've got this condition and now I've got to do this and I have to have surgery or I have to go have these tests done. By the time you leave, you don't even know what questions to ask because you haven't even processed it all the way. So,
Exactly.
I mean, it is amazing to be able to have somebody that can understand that. Says, "Oh, okay, I know what tests you have to get done or what surgery you have to have, and I can help you navigate through that." I mean, that is huge. Um,
Yeah, it is. And sometimes that support is provided in real time. So I will attend doctor's appointments, typically
mhm,
virtually. I just did this a couple of weeks ago with a client, and she got permission from her doctor ahead of time. In fact, there were two doctor's appointments, and she called me up on her cell phone, and I was on
mhm,
speakerphone. And I was in there real time, able to hear what the doctor was saying. She and I had come up with some questions ahead of time. I asked some of the questions, she asked some of the questions. So yeah, it's a big relief. And I was taking notes in the
mhm,
background because I think the studies show that patients remember about 20% of what the
mhm.
doctor says. And so, having someone you can focus on maintaining eye contact with the doctor and listening, but I'm in the background taking notes so that then we can
Right.
debrief afterwards and make sure that you understood
Yeah.
everything.
Yeah, I mean that makes so much sense. What's funny, I was literally just thinking about that question. I'm like, who do you go in person or virtual? But I mean, it is so necessary, especially when, I mean, in my world, when I'm working with patients that are on biologics and especially medications, they're leaving the office not realizing what the next steps are. With these specialty medications, we got to go to a specialty pharmacy and you have to deal with the prior authorization process, and they leave and have no idea. They're like, wait, I didn't get my prescription, or I went to the pharmacy and it wasn't there. And I'm like, well, there's a reason for that. So, my job is definitely a lot of that education and helping navigate the access process. But, when you're dealing with, a surgery or just a really difficult diagnosis that you are trying to understand, and sometimes it can hit you like out of nowhere. And you're like, wait a
Mhm.
minute, what? I don't even know what I'm doing here and why I'm here. And, it's very overwhelming as a patient. And I always try to put myself in the patient's shoes just to try to understand what they're going through and how they're feeling. What are some of the, I guess, disparities that you see that you talk about?
Mhm. There's so many, so many disparities. A lot of my work has been in the maternal health equity space
Mm,
and really addressing and educating about the fact that Black women are 3 times more likely to die from childbirth related complications and 2 times more likely to suffer maternal morbidity, which is like a severe unexpected complication
mm,
that doesn't lead to death. But there's disparities in everything. I mean, even in pediatrics, there are studies that show that children with appendicitis don't receive appropriate pain medication compared to their white counterparts. So Black children are less likely to receive
mm,
appropriate pain medication. Black patients are less likely to be listed for transplantation when they are approaching kidney failure and much more likely to be placed on dialysis. Black patients are have longer wait times in the emergency department when they present for stroke, which
wow.
every minute, literally every minute counts with stroke and heart attack. Like I could go on and on and on and on. But, there are a lot of disparities, not just in access to care, which kind of relates to the higher kind of structural types of barriers that we face. And that's not just Black people, but brown people and people with lower income. But then there are actual disparities in the care that
Mm.
is received. And even with guideline therapy and protocols and all of these things, there's still evidence that unfortunately, sometimes doctors are literally not providing the same treatment to their Black patients as they are to non-Black patients. And that goes back to some of the biases that you
Mm.
were talking about. I don't believe any of this is conscious or intentional. I really
Mm.
don't believe, for the large part. I mean, I don't think there's doctors out there that are like, I'm not going to treat this patient properly. But the reality is that because of biases, sometimes it has to do with perceptions of who
Mm.
someone is, what they're capable of, what they're capable of understanding, what you think they might be interested in. So we know that clinical trials, as an example, Black patients are much less likely to be offered access to clinical trials. And if you ask healthcare providers, they will say, oh, they're not interested. Like Black people generally aren't interested. But that's actually not true. So, but there's a presumption that we're not interested because of a lot of historical things and mistrust. But the studies show that if you actually take the time to sit down and explain it and talk to Black patients so that they understand, then yeah, many of them are happy to be part of clinical trials. So
Mm.
there's just this whole system that reinforces many of the barriers that some of which have been present, for centuries. And
Right.
unfortunately, we haven't been able to overcome many of those.
So how do you help people identify that, their own bias, and kind of overcome that?
Yeah, there's some exercises that I do in some of my talks. A lot of it is really having people just sit and think about what what was a time when you saw someone and a thought just immediately went into your mind, a
Mm.
negative thought. And so that may be someone based on how they're dressed, maybe based on how they're speaking, based on where you saw them. There's all kinds of things. And all of us have biases. I mean, as I'm
Mhm.
talking to you right now, I'm thinking of there are certain things that for me, it's like when I see it, there's an immediate thought. But the difference is that to be able to identify that thought, that's the first thing,
Mm.
and then question it. And not to judge yourself. It's not to say, oh my God, I'm a horrible person. It's literally our brains are created to do this because it's the way that we sort big chunks of information quickly. Otherwise, we'd be obsessing over every little detail and we literally get nothing done. And
Mhm.
so our brain is structured to group and to lump certain things based on, oh, there's this characteristic. That means they are like this. So identifying these thoughts that immediately populate and then questioning them, like, is this really true? Why do I believe this? Why did I learn this? Did I hear this somewhere? Did a
Mhm.
politician say this? Did my mama say this? Did my teacher say this? Or is this something that I know to be true based on experience? And then being open to a new thought, like replacing that thought with, no group is all the same. Like none of us are a monolith. And so being willing to challenge the biases that we have and just see every encounter with someone as an opportunity to learn something.
Right.
So, to never assume that because you look a certain way or you dress a certain way or you have a certain income, that means that you're like all the other people who look that way or dress that way or have that type of
Mhm.
income. But it
Yeah.
starts with acknowledgement. And unfortunately, not everybody is willing to acknowledge that. And all of us
Mhm.
want to believe that we don't have any biases because we all want to
Right.
believe that we're great people and most of us are, but they're not limited to bad people.
Right.
All of us have
Yeah.
them.
Do you feel like it's been like on, I guess, on the industry side, do you feel like that's been very well received?
In there was a season where I was very how do I word this? Booked and busy, like there were a lot of healthcare organizations who wanted to explore this topic. They wanted their
Mhm.
physicians and their nurses and their other staff members to learn this information. Now, in the current client, I'm not getting asked to speak about these things, to be very
Mhm.
frank. And, my hope is that the work is continuing behind the scenes. I know, there's a lot of challenges that organizations are facing with what they can say and what they can put on their websites. And I definitely understand and appreciate that.
Mhm.
But as long as the work is happening, I don't
Right.
really, whatever you call it is fine. But I will say, there's definitely been less of a demand
Right.
for that type of work.
Yeah. How about for on the patient side? How do you educate patients and help them understand? I mean, I feel like a lot of times it's they have to be able to know what questions to ask and
Hmm.
not just to accept what was told to them. So if they feel like, hey, you know what? I appreciate your answer and the response that you've given me for this diagnosis, but I really feel like I should get a second opinion, or, even asking those questions and, not necessarily challenging the provider that you're seeing, but, almost kind of, if you feel like you need to get a second opinion or get another test, how do you help patients understand those, I guess, intuitions and be able to express
Yeah.
that, in a respectful way, so that it's not coming off like, oh, well, you don't know what you're talking about, I need to go see a different doctor.
Yes, absolutely. That's such a good question because honestly, your ability and comfort with asking questions could, in some cases, be the difference between you thriving and not thriving. And in some
Hmm.
severe cases, you living and not living. And so I have a framework that I like to use when I'm giving talks in the community. And it's called the GPS framework, for GPS doc. But the G is to gather information. And that's where I'm always encouraging individuals, patients, communities, families to ask questions. It's one of the most important tools that we have in our advocacy toolkit is to
Hmm.
ask questions. Again, not to be adversarial, but largely to make sure that you understand what's going on. So many patients, especially in this current environment where the doctor's appointments are so short
Hmm.
and they know that the doctors are stressed out, they will say like, "Oh, I didn't want to bother him," or "I didn't want to bother
Right.
her," and they're so
Yeah.
busy. But if you don't understand what they're saying, you have to say, "I'm really sorry, Dr. Rochester, but can you repeat that again? Because I'm not sure I understand." So asking questions is really important. That's the G, gather information. And then the P is to position yourself as an expert. And this is also really important. And again, it's not being adversarial, but what I say is that nobody knows you better than you. Like nobody knows your body. You didn't go to medical school, you didn't do a residency, all the things that, I and many other physicians did, but that doesn't negate the experiences that you've had as a
Hmm.
patient and as a family member. There were so many times where my sisters and I took our dad to the doctor and we knew something was wrong because we know our dad. And so
Hmm.
there was just something off with the way his cognition was. And sometimes, unfortunately, they would do a little quick exam. Oh, he looks fine. And then a day later, it would fully manifest itself and we'd be right back. And
Hmm.
I've seen that over and over again with friends, family, clients, where the spouse or the partner or the child or the sibling, they see things, they know things, or the patient, like they know their body best. So this idea of positioning yourself as an expert is owning that you really are the expert for your own body. If you're a caregiver, you are the expert for your loved one, and standing in that power and not shrinking and not
Hmm.
deferring all of your authority because you feel like they're smarter than you or whatever.
Right.
And then the S is speak up. And that really is that part, like you talked about, where trusting your gut, we all have an intuition. And
Hmm.
so many times I've worked with clients and they'll say, "Oh my gosh, Dr. Rochester, 6 months ago, I knew something was wrong, but I didn't speak up because the doctor said everything was fine or my labs were normal." So this idea that, you know, respectfully speak up when your gut is telling you that something's wrong, because normally it's right. Normally your
Right.
intuition is right. And it may take a while. It may not be immediately obvious to the medical team, but when you're able to have a collaborative relationship with your doctor, and good doctors should be totally open to that, then you
Hmm.
can express your concerns in a way that's not threatening. You can ask for a second opinion without that provider being offended by that. In fact, they should encourage that. I'm happy to say I know a lot of doctors who openly encourage second opinions, particularly for a life-altering, life-threatening diagnosis. So,
Hmm.
so yeah, those are the three things that I usually speak about when I'm speaking in community.
That's good. I like that. Very easy to remember.
Thanks.
But yeah, I love that a lot. So you're so busy. You built a business, become a speaker. You've also launched a podcast. What has surprised you the most about life as a founder and an entrepreneur?
Whew, let's see. What has surprised me the most? One of the things that has surprised me the most, because I mentioned earlier in today's podcast that I never thought I would be an entrepreneur.
Mhm,
I think one of the things that has surprised me the most is how much I love what I do, because I really loved being a pediatrician, and I at that in that season of my life, I thought that we just have one purpose, and I know that that was part of my purpose, being a
mhm,
pediatrician, and so it was hard for me to accept that this other thing was also part of my purpose. And so I think that's been one of the most surprising things, is that one, we all may have more than one purpose, and sometimes even in our career there are seasons. And then the fact that I was able to find, or have been able to find, so much joy and satisfaction in what I'm doing, that
mhm.
has nothing to do, well, not nothing, but I'm not a pediatric doctor, a practicing pediatric doctor. That surprised me a lot. And I guess the other thing I would say that has surprised me is just the learning all of the ways that my medical degree can be used outside of the exam room.
Mhm,
And, just having amazing opportunities to partner and collaborate with public health departments and hospitals and health systems and pharmaceutical companies and community organizations and churches. And, it all started with a medical degree and a caregiving experience. And I'm living a life that I never could have dreamed of.
Yeah, it's exciting. So also as you're a mom as well, but how do you stay grounded while holding all of these roles?
Whew. That's I I am a mom. My kids are grown up now. They're young adults, so that has helped. I'm not having to do, a lot of the things that I had to do when they were
Mhm,
younger. But I think the main thing that keeps me grounded is my spirituality and my spiritual practices and my connection to God and prayer, and just
mhm.
really seeing everything that I've been able to accomplish as a blessing. It keeps me very humble, and so I'm grateful. And so having a gratitude practice and just being rooted in my spirituality and understanding that, I'm doing the work, but I feel like for me, this is all God
Yeah,
working
that's
through me.
amazing. Yeah, I love that. I was gonna say, I feel like just talking to you right now, I feel like you just have just a way, I guess, to connect with people, and it makes people feel comfortable. So it's
Thank
really
you.
exciting to hear what you're doing and how you're doing that. I love that you're able to do virtual calls. So you don't just work in Maryland where you're at. You're all over the country.
Yeah, that's correct. I take clients all over the country.
That's awesome. So, okay, if anyone is listening that's a clinician that's considering a pivot or a passion project, what's one piece of advice that you would offer them?
I would say go for it. Really, I would say go for it. If there's something that you are thinking about, dreaming about, at least explore it. I
Mhm,
think that medicine, for many reasons, many of which are good, it keeps us locked in sometimes. One is the salary.
mhm.
We make good money as physicians, and it's such a long road to get here. And so many of us, myself included, can't imagine this idea of quote unquote giving up your medical degree, but you're not. Like I
Yeah.
mentioned, I've been able to use my medical degree just in a different way. So I think you owe it to yourself to explore the many other ways that you can leverage your medical degree, both clinically and non clinically. And if
Mhm.
I can make a shameless plug, if you're listening and you're a doctor and you want to specifically explore health advocacy, I would love to talk with you. I have a coaching program for physicians who want to do health advocacy, and I enjoy having conversations with physicians about this
Yes.
topic.
That's exciting. Yeah, definitely. We'll put your information in the show notes as well so that anyone can find you. But also, anyone that is needing your services for a loved one or themselves, what is the website and how can they? get a hold of you?
Yes, thank you. The website is yourgpsdoc.com. And whether you are a patient or a family member who needs health advocacy services, or if you are an organization who wants me to come speak or consult, or if you're a physician who wants to learn more about coaching, all of those links are on that. You can find all of that on yourgpsdoc.com.
Okay. There's so many good topics. I feel like we could go on and on and go more in depth on some other things as well. But I hopefully we can do this again. But this has been such a pleasure having you join me and chatting today and learning about your GPS doc, your company, and it's been so exciting. So thank you so
Thank
much.
you, Janelle. Thank you for
Yes.
having me. This has been a long time coming, so I'm really excited that we got to have this conversation, and I would love to come back for a part two.
Yes, yes. I love your passion for healthcare advocacy. That has been something that I've been really passionate about as well. And I feel like it's so motivating, and hearing other people and their passion and what they're doing, it gets you so excited all over again. So
Thank you. Thank you so much.
now a message from Sun Pharmaceuticals. For patients with locally advanced basal cell carcinoma who are not candidates for further surgery or radiation, hedgehog pathway inhibitors offer a targeted systemic approach. Staying current on these therapies can help you expand options for appropriate patients. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.